We're following new developments this morning out of Gaza, and Israel says it is banning more than 36 humanitarian organizations from operating in Gaza, citing an alleged failure of the organizations to adhere to new registration rules for NGO personnel. The move comes as Gaza's government media office is providing new figures on the number of dead in the territory. It says more than 29,000 Palestinians were killed in 2025 alone, and more than 150 children died of starvation. For more on all of this, we've brought Bushra Khalidi onto the program. She is the policy lead in the Occupied Palestinian Territories for Oxfam, joining me this morning from Jerusalem. Thank you so much, Bushra, for being on the program with me.
Thanks for having me.
So 37 aid groups working in Gaza now have their licenses revoked. What's your reaction to this?
So just to clarify, this is not yet a revocation. It is a signal that it will be revoked if we don't comply, and we are unable to comply. So we're not yet at the final stage. We submitted our registration application months ago. We engaged in good faith with the Israeli authorities throughout the process, alongside other organizations in the UN. And so, applications are being deemed incomplete solely because organizations are refusing to hand over the sensitive personal data, the Palestinian staff and their families, and also because we don't want to accept the vague and the political and ideological conditions that are also imposed under these new registration rules that are unrelated to humanitarian work. So technically, this is not yet a final revocation or deregistration decision, but in practice, obviously, the effect is the same. Access remains restricted, materials remains blocked, and the humanitarian continuity, of course, is undermined.
And all of that kicks in tomorrow. Israel is saying that these new rules are meant to enhance security and transparency to register aid workers, as you were just mentioning there, so that Israel says it can suss out who has links to terrorism. Help us understand why so many aid groups like yours and Doctors Without Borders and many others are refusing to do this.
Well, because first of all, it would put people at risk. We're being asked to hand over highly sensitive personal data of Palestinian staff and their families, so including their kids, their wives, their spouses, without clear safeguards, without transparency, and that would violate our duty of care and international data protection standards. But this can't be separated from the context. You know, Gaza has become the deadliest place on record for humanitarian workers, with hundreds, over 500 killed during the genocide. So in an environment where aid workers and our colleagues have been systematically exposed to harm, transferring personal sensitive data to the same forces that have killed them, would fundamentally increase the risk. So our responsibility is to reduce the risk to staff, not add to it. And so again, this is not a procedural issue in the way Israel is framing it to be. It's about being asked to endanger people as a condition to deliver aid. No humanitarian organization should be forced to choose between protecting its staff and delivering life-saving assistance.
And as if to underscore everything that you're saying, Gaza's media office today is reporting that at least 500 aid workers and volunteers have been killed, along with an additional 2,600 Palestinians in what they're calling aid traps. Obviously, the dangers you just laid out, but what is going to happen now with all of these aid groups unable to function as they have been?
Well, it, of course, will severely restrict our ability to bring in materials, even though we have been prevented from doing so since March. It will prevent us from scaling our operations up and respond at the level that is required right now in Gaza. But of course, we're committed to continuing our work. So we will stay in Gaza as far as we are able to. We'll continue working through local partners. We'll procure on the local market. But of course, these are suboptimal workarounds. They're slower, they're more expensive, and they're far less effective at scale. But a humanitarian response, again, cannot function when access is conditional or on political compliance, or when aid is deliberately blocked at crossing. So this doesn't obviously undermine just us as Oxfam, but the entire architecture of the humanitarian response. And of course, the impact is on the communities. For families in Gaza, this will mean slower repairs and fewer supplies and longer waits for basic services. And it will affect direct access to clean water, for example, to shelter materials or to public health interventions. Communities are already facing hunger. They're already faced displacement multiple times over the last 2 years, and disease and preventable illnesses. The impact is really not abstract. It's borne by the families that are already surviving day to day in Gaza today.
Now, yesterday, Canada's Foreign Affairs Minister, Anita Anand, joined 10 other countries blasting this new framework as restrictive and unacceptable due to the dire humanitarian need that you just laid out in Gaza. They also called on NGOs to be able to operate in what they said was a sustained and predictable way. Can you explain for us why that's so important and what you think of the international reaction that you're seeing from folks like Anita Anand?
Well, I'm tired of hearing statements of condemnation, really. Statements of condemnation did not stop the genocide. Statements of condemnation don't stop the killing. Statements of condemnation are not improving access in Gaza and have not for the last 2 years. So it's not enough. It's subpar, to be honest, at this point. 2 years of siege, of blockages, of killing, of bombardment, of displacement, of the most despicable violations of international law we have seen in recent modern warfare, and yet that is the best that member states could do. It's unacceptable, really, at this point. They should be using all of their diplomatic, all of their economic, all of their political leverage that they have. They're choosing not to. Humanitarian access must be predictable, principled, and at scale. That's what humanitarian law says, and it cannot be conditional on political compliance or ideological tests or endangering staff. It's not optional. It's a legal obligation under international law, and right now it's being violated.
Bushra, thank you so much for joining me on the program this morning. I appreciate your time.
Thanks for having me.
Bushra Khalidi is the policy lead in the Occupied Palestinian Territory for Oxfam, joining me here on CBC Morning Live.